Hey guys, Local 479 Health and Wellness Day 2017. Kevin Amick here, your Director of Education. Just kind of want to give you all a look at what's going on, and so we're going to take you through a quick tour of what we're doing and how you do it. So first thing we're going to do is we're going to go sign in, all right? Let's go sign in. All right.
Right here.
All right.
Feel free to put your name, grab a yellow gift bag if you want it. And then you can take this smaller sheet here, fill that out, and then take it to each vendor and have them initial their square, and you bring it back, and you're eligible for a door prize.
Eligible for a door prize. All right, guys, so let's go. Let's see what we got going on today. And we don't have to be present to win?
No, you don't have to.
Hey, let's go look and see what they got on the table to give away right now.
Yeah, there's all kinds of stuff. So
All
there's
right.
a tablet, which is amazing. From Gastronology, there is a goodie bag with a gift card in it. DentalOne Associates also has a gift bag. X3 Sports has a gift bag. I think they also put a free couple of classes in there. Salad Masters has a nice bowl. There's a free teeth bleaching, and I think there's a few others on the other side that Pat has. Kat and Sarah from Young Workers Committee. If you're under 35, come on out to our Young Workers meetings. Thank you.
All right, guys. So, by the way, young workers, you got reps here. Let's get it. We want you. All right. So, a little bit about what's going on. So, we're going to go into the medical screenings, allergy, pre-cancer, biometrics, pain prevention, PSA. That's for the prostate check, folks, and more. All right, here we go. So we'll come in, we're going to go through the front office. All right, so here we go. We've got Miss Laura Lynn over here. Laura Lynn.
Hi, everybody.
All right.
Come out and see us. There's some great stuff today.
All right. And Laura Lynn, who we got here?
This is Randall.
How are you guys?
He's a great guy. He's with the healthfairsusa.com if you want to go to their website.
Yeah, we got a little bit of everything here today. Do like Kevin said, allergy testing, food sensitivity screening, pre-cancer screening, meditation sensitivity testing, a little bit of everything. So come on out.
High blood pressure.
Cholesterol, yeah, biometric screenings.
Come on out, y'all. We got medical screenings, like Randy was saying. Allergy testing, you know, it's right around the corner, allergy season, high pollen count. So it's a great opportunity for y'all to come on out and get tested for some allergies.
All right, so here we go, guys. So what you want to do is you're coming in here, and first thing is you got to check in. So you're going to come in here, see the ladies over here, and they're going to get your information and then get you started on what you want to do today. So again, we got a little sign here, a little bit about what's happening. Health Fairs USA. All right, let's go. So we're going to come in here. This is our triage station over here. You come in, you meet one of these ladies. They're going to triage you. All right. Oh yeah, the dreadful scales. All right, we got anybody on there, Andrew? Yeah, we got folks on there. All right, so then from there you go over here and we're going to start our testing. A lot of paperwork, a lot of stuff going on. But they're going to get everything they need and get you took care of. Again, a little more information on what's happening here. All right. Then we got provider station over here. They're going to come over here, take your information. They got all kinds of stethoscopes and what are we doing over here? What we got going on over here?
We're just doing some patient quick survey and checking out the patient, listening to the heart, lungs, and putting them in the database and then sending them back over here.
All right, guys. Health and wellness, making sure you're getting checked out. All right, let's go around. So we got lots of folks here today representing. You know, once you go through the whole process, we've got Georgia Urology, we've got Renew Medical here. So once you go through the whole process of everything's going on, and you get checked in, and then you get checked out over here.
Hello, how you doing? My name's Amina. Yes, I'm checking out everybody that's being seen here for our services, and we're really happy to be here today.
All right, All right, thank you very
Don't
much.
forget the prizes.
Don't forget the prizes. All right. So if y'all want to come in and come through the side entrance, we also have another check-in over here. We've got folks over here that's going to welcome you and get you signed in, get you a bag. Same process, give you the price sheet. Oh, I mean the place where you can go and visit everybody, and you get checked off, and then we'll just keep moving on. So let's move it on. All right. So, and then in this, we're in the galley now. So over here, people are coming in, grabbing some snacks, a little bit of fruit. We've got some cookies, crackers. We've got some bananas, fresh cut fruit. We got a lot for everybody. Just trying to keep you in. All this energy is getting spent today. We got to replenish it, right? Okay, moving on. All right, so here's where a lot of the action is taking place. We got a lot of different vendors in here. So we're just going to go around, kind of go from table to table, kind of show you what's going on. We've got our friendly brothers here from the Clayton County Fire Department.
Good morning.
They're coming in today. They brought the fire truck. You know, they're out here in the kid zone. And we do want to thank them for coming out here and representing Clayton County Fire Department.
Honored to be here. Very well, thank you.
Thank you, guys.
Thank you.
All right, so we've got a lot of different folks in here today. They're representing so many different things in our life as far as our health and wellness. We've got skin care, going on through here. This young lady over here, she's taking care of you. She's going to check, she's doing the diabetes checking over here today. What is your name, young lady?
Mary Salome.
Miss Mary. Well, Miss Mary, thank you very much for coming in today and taking care of our members. Folks, if you haven't had your blood sugar checked in a while, come in here and see Miss Mary, and she's going to check your blood sugar and see where you're at today. All right. Hey there, young man. How are you?
Good.
I'm good. Kevin Amick, sir. What's your name?
Avery Johnson.
Avery Johnson. What are you here for today, sir?
Test screening, like for cancer test screening right now.
All right.
Do you have a past, family members that has breast cancer, colon cancer, ovarian cancer, or prostate cancer?
All right. So these are some questions that he's going to ask you today if you come in here. What they're trying to do is establish some family history, going in here and talking about all the elements that could be a sign that you may need some early screening. Early screening is the best prevention on cancer, hands down. And so what they're doing here today, they're providing that, gathering the information, and hopefully, if for some reason that cancer was to find you, we find it early. The earlier you find it, the easier the cure.
Right.
All right. Thank you very much,
No
sir.
problem.
All right. Ladies, how y'all doing? So y'all here with us, y'all all together here, so y'all with our pre-screening and everything. And in your name, young lady?
My name is Tamika Williams.
Tamika?
Tamika,
All right, Tamika.
Ashley.
And Ashley. So thank you ladies so much for coming out today and providing this service to our members. All right. All right, so now here we go. We got the folks from the Fresh Market here with us today. And so they brought in here, and they've got lots of fruits and vegetables that they're providing today. This is fruits and vegetables for sale, but they're coming in here and offering this to you at a good price, and it's healthy for you.
That's right.
All right, we got.
That's right.
All right. Good morning, sir. How are you?
Hi.
Young man, what's your name?
I'm Mr. Muhammad.
Mr. Muhammad. Mr. Muhammad, tell me a little bit about what you got here today.
Well, we got some natural bread. Some of them we grow ourselves, and then some of them we get from the farmers who grow healthy vegetables and everything. And we recommend people eat a lot more vegetables than they are doing because of the situation. As far as sickness is concerned, we are now finding ourselves eating less vegetables. We need to go back to what we used to do, eat more vegetables in order to keep our immune system up and well. And I recommend people eat things like tomatoes and onions to keep their immune system going throughout the year, and garlic and all that. That will help. And then add a little fruits over here. We got apples
There's
over
some
here.
apples. Now, what kind of apples we got here?
These are pink ladies.
These are pink ladies.
And then we got some honeydews here.
All right. Yeah, we know about honeydews. Anybody's got a wife got a honeydew.
Mangoes here, which has abundance of vitamin D and vitamin C. And we got the bananas here. People who might be low in potassium, and then we got some grapes here for people who love grapes. And all of these, and then we got honey. Honey is a thing that you get, this is the time of year that the climate is changing, so people now, they use honey to help offset the pollination of the, you know, the bee pollen will help you from the getting the,
with the allergies?
Allergies,
Yeah,
exactly.
right.
You got it right. Allergies and stuff.
All right. Another line of defense for our allergies, folks.
Another defense. All
right. And we got muscadine cider blush. Tell me about that.
Now, muscadine cider, if you look it up, this the only company that grind the seeds up in this muscadine cider, and then we got the information on the muscadine that the muscadine, drinking the muscadine can prevent cancer. Right here, you see it right there.
I got you. All right.
So,
all right.
So this is good for you. I've been drinking it
so
for about 5 years.
All right, but this is a vinegar. Now we drink it straight, or do we mix it with water?
It's just no, you don't, unless you're diabetic.
Okay.
If you're diabetic, you don't want to.
Okay.
It's sweet, very
okay.
Sweet.
All right. So if we're diabetic, then we want to do it in moderation, and probably want to dilute it some there. That way we're cutting down on the sugar on that.
That's right.
All right. Well, Mr. Muhammad, thank you so much.
Thank you
for coming out and bringing this wonderful thing to our health fair today.
That's right.
And we appreciate it very much. Thank you.
Appreciate you.
Now, who's this young lady over here?
That's my queen.
That's the queen.
And this is my grandson.
The queen and the grandson. All right. Thank you so much for coming out with us today.
That's right. And these are some of the pictures that we got. We grow some of our organic vegetables in the greenhouse, you know, and a lot of them in the greenhouse. And the greenhouse is like you could grow almost year round. You know, you could, you know, and say, you know, I got a tractor can get inside there. You see me on the tractor, and these are the outcome of the greenhouse. These are some of the bell peppers and stuff that we grow in there. This is the cabbage and the kale and the collards that we grow in the greenhouse, and these are the broccoli that we grow in the greenhouse, and then we got broccoli coming right now. We got some down there in the cooler.
All right.
And everything. And we also in the greenhouse we grow tomatoes, and now got these coming out of the greenhouse, and of course we got an herb. Get these herbs here. Come.
Mr. Muhammad, thank you so much.
Thank you.
Have a
Thank
great
you.
day. All right. All right.
Come on over, sir.
All right. So here we go. All right.
I wonder if we can get a comment.
All right. So, okay, we're going to work around the room here. And so over here, we've got our folks from Salad Blaster. And and what's your name, young lady?
I'm Angie.
I'm Angie. And so I was talking with Angie earlier today, and she was giving me the history of Salad Master. And she was telling me that you've been in business
71 years.
Salad Master been in business 71 years. And so they're bringing in here today healthier cooking. They're educating on how to get the most nutrients out of your cooking using vegetables, cooking without any greases, any butters, and all the things that we really, really like that are really, really bad for us. So they're coming in here. And one of the things that they're showing today is their salad cake. And so they're taking all of these vegetables from right here, and then they're coming up with salad cake. So come on in, get all the free sample of salad cake you want. And I believe they're telling me that each piece is 20 calories. So for those of you that are counting calories, there you go. Hey, you can have quite a few pieces before you get up there. So come on in, have some salad cake, and she's going to take care of you. She's going to educate you. And the best thing about it is they're going to come in here. Hold on a minute. You can come in here today and sign up for a free dinner, and they're going to come into your house, and they're going to bring everything that you need for a free meal. Only thing you got to provide is the house and your beverage of choice, and they'll come in and they're going to cook you a very nutritious meal using their cookware without butters and greases and all the waters that are stealing all of your nutrients. So anyway, we're going to move on.
Excellent.
Thank you so much.
Excellent.
All right, so we're going to move on, guys. So hey there.
Hi, how are you?
I'm good. Your name?
My name is Marjorie Coley.
Marjorie, thank you so much for coming in today and being a part of our health fair. And Miss Marjorie, what are you bringing in here for us today?
Well, actually, I work with Dr. Patel. He's a vascular and interventional radiologist, and he does a couple of non-surgical treatments. One is for leg pain and people who have PAD, which is peripheral arterial disease. So he can do a non-surgical procedure to treat that. But also he does a non-surgical treatment for women who have uterine fibroids. You know, fibroids cause a lot of issues for women every month, and a lot of times women just suffer through it. Oftentimes they're only offered surgical options, a hysterectomy or a myomectomy. Dr. Patel does a non-surgical procedure called UFE, uterine fibroid embolization. It takes about 45 minutes. Patients go home the same day with a Band-Aid. The recovery period is about a week. And what's interesting is he does a newer procedure which is done through the radial artery in the wrist. Procedure that's done through the wrist, the radial artery. So it's covered by insurance. We want all women to know if they have fibroids, you don't have to suffer. You don't have to suffer in silence. Come see us. Go to our website, AtlantaFibroidClinic.com.
All right. Thank you very much.
Thank you.
Appreciate you coming out today.
Alrighty, thank
All right,
you.
let's move on. All right, and so we've got here today. Your name, sir?
Scott.
Scott?
X3 Sports.
Welcome, sir, from X3 Sports. Scott, tell us a little bit about what you got going on here.
We are a training facility. We do martial arts, fitness-oriented, kickboxing, boxing, and we do several martial arts, Brazilian Jiu-Jitsu, and Muay Thai. Muay Thai is a striking martial art, using your 4 limbs, 4 points of contact here. And we do a lot of fitness-oriented activities, but we actually track our members to make sure that they're progressing throughout the programs.
Okay.
We're very successful at what we do. Most of our members will train 3 to 4 times a week after their memberships expire. A year after the memberships expire. So
Okay.
it's a little bit above the industry norm.
Okay.
So what we do is, we focus on the members' goals and make sure that they're hitting them. And pretty successful at what we do, have a lot of fun with it.
All right.
We're a smaller facility. We're not like a mega gym.
Okay.
Where sign you up, forget about you.
All right. Tell me real quick, age group.
5 years old, depending on how cognitively
Okay.
they can adapt to the programs, all the way up to 78 as our oldest
All
member.
right, 5 to 78, folks. That covers about 100% of our membership. All right. So thanks very much for coming out today.
Thank you.
We appreciate it.
Appreciate it
very much.
Have a good day.
All right, and if we may, I tell you what, our next guest here, they're coming in today for us. We've got AAA with us here today. And young lady, your name?
Elaine Strawberry.
Elaine Strawberry. Elaine's come in and she was telling us about the benefits of AAA. Guys, if you come in here, she's got lots of information. She's going to offer you 2 for the price of 1, and also you get 14 months instead of 12 today.
And teenagers are free.
Teenagers are free. So, folks, for all of you members out there that got teenagers, AAA, they're free. You can put them teenage drivers on AAA for nothing. All right?
0.
All right, guys. So come on in, see her today, and she'll give you everything you need and hopefully get you signed up for AAA.
Thank you so much. Thanks for having us.
All right. All right. So we're coming down here. We've got DentalOne Associates today. And your name, young lady?
It's Molly.
Molly, thank you so much for coming in today.
Thank you.
Molly, tell us a little bit about what you got going on here.
Well, we're a preferred provider with most dental insurances, including Delta Dental, and we have 18 different locations across the greater Atlanta area with multiple dental specialties, including pediatrics, oral surgery, orthodontics, and periodontics.
All right. Well, thank you so much for coming out today. We appreciate you coming out and informing our members on in their benefits. Thank you so much.
Thank you.
All right. Hey there. All right. So now we're over here at Atlanta Gastronology, And so they're here today to educate us on, early treatments and things of that nature. And your name, young lady?
I'm Tiffany Henderson.
Tiffany Henderson. And your name?
I'm Raji.
All right. So tell us a little bit about what you got going on today.
Yeah, so we have information here about all of our locations. We are one of the largest GI practices in the country. We have almost 50 locations in Georgia alone. And we are educating people about colon cancer, the screening guidelines for that, when to come in, and then just general information about our office. We have a pediatric location, liver center brochure, all kinds of information. We have some goodies.
Well, thank you very much. And folks, please, you need to understand your family history. You need to understand the disposition of cancer and what are signs of cancer and different things. They have some brochures here for you today. Understanding your health. And folks, you need to understand what your body's doing because if you'll pay attention to the signs of it, it could very well save your life. So think about that as you come in here today. Come over here and see our folks at Atlanta Gastronology, and they'll give you some information and get you where you need to be, okay? All right, let's move on and see what else we got. Thank you. All right, so we've got folks here from Boston Scientific, but guys, they're on break. We'll come back and maybe, wait a minute, here she is. Here she is, she did. She's went out and got some trail mix and some coffee. And so, good morning.
Morning.
Kevin Amick, what's your name?
Kelly Sanders.
Kelly, how are you today?
Well, how are you?
Tell us a little bit about Boston Scientific and what you've got going on today.
So I'm with Boston Scientific, the AMS Men's Health Division. So we've got some educational programs going on in the community that we're advertising for today. So we've got that. We've got a men's health newsletter. So just trying to spread awareness on men's health topics.
All right. Well, thank you very much, Kelly, for coming in.
Thank
And folks,
you.
listen, men's health is important, guys. I know we're busy and life is busy. Come on in, and you got to know what your body's doing, folks. Come on in and see Kelly today. All right. So we've got Encore Plus. Again, we're talking about some free mammograms and stuff like that. There's plenty of information, understanding breast health and breast cancer risk factors. They've got some pretty cool free swag here for you today. And so you guys come on in and they'll get you took care of, okay? All right, so now we're coming over here to
LifeLo Therapy.
LifeLo Therapy.
Therapy.
And your name, young lady?
My name is Shanita.
Shanita,
Yes.
thank you so much for coming in today.
You're more than
and
welcome.
tell us a little bit about what you got going on.
Yes, what we have here are a variety of different styles of compression socks, and they come in stockings as well. I wanted to show a showcase of different styles that you can get. They're no longer Mrs. Doubtfire.
Okay.
So they improve circulation in your legs, prevent swelling, help prevent varicose veins, and definitely help prevent blood clots. You know, blood clot is a leading health problem that we have nowadays with people standing all day long, sitting all day long. They're not getting the circulation in their legs. If you're traveling all the time, you're not getting that circulation moving. And blood clots can form. So these are designed, especially socks designed, where you have the highest compression at the ankle, gradually decreasing pressure going up the leg, bringing that volume of fluid back up.
So these would be perfect for people who are standing on concrete like 12, 14, 16 hours a day.
Yes, sir, definitely.
All right. Hey, folks, by the way, that's about like 100% of our membership again. Hey, listen, they come in awesome colors, shapes, and sizes, and they can get you hooked up. All right, things like plantar fasciitis. How many of you guys out there have plantar fasciitis? They've got these compression socks that'll help you with that. And everybody out here with knee pain, look, folks, they got stuff designed just for knee pain. So, and she can come in here and give you a lot more information, but you need to be here, and she's going to be nice to you and just tell you all about it, and hopefully we can get you hooked up to where your feet and legs and everything's not hurting so bad after an 18-hour day on set. All right? Thank you so much.
Thank you so much.
All right, let's see what else we got. All right, so now we got Northside Hospital Cancer Institute.
How you doing?
Your name, sir?
Kenny.
Kenny, welcome to Local 479 today.
Thank you.
Kenny, tell me a little bit about what you got going on here.
So with the Cancer Institute, unfortunately with cancer, you can't prevent cancer, but you can control risk factors and you can have your screenings done and you can have early detection. That's the most important thing. So we have a lot of different information on risk factors, what each cancer is involved in, the way you eat, smoking, things like that, that all affect your cancer. So definitely understand what each cancer is involved, the signs, symptoms, risk factors, things like that. And then we actually offer free screenings throughout the year. So we do free skin cancer screenings, prostate cancer screenings, and we do free mammograms for women for breast cancer screenings too. So each of those we have involved. And then we have a little bit of sunscreen here for you guys because we know that you're probably standing out in the sun a lot. Definitely important to wear your sunscreen, prevent those ultraviolet rays causing skin cancer.
All right. Well, Kenny, thank you so much for coming in
for having
today.
us.
And folks, by the way, as he said, what they're doing here is free. This is not something that you got to qualify under your insurance and all this stuff. They're doing this. They're out here trying to save lives. Again, if they find it early, it can be fixed a lot easier than when it gets in the late stages. So, listen, we're never too busy. We think we are, but we're really never too busy to find out what's going on with our body, okay?
Absolutely.
Kenny, thank you so much.
Thank you again.
All right. All right. So now we've got the folks over here with Superior Vegan. And so, hello to Kevin Amick.
Hi, I'm Sandy. How are you?
Sandy, I am great. How are you today?
I'm excellent. I can't complain.
Sandy, you've got a lot going on here.
We do.
Tell our members here. We're live on Facebook here.
Oh,
tell our
okay.
members that aren't here what you brought in here for us
Well,
today.
we have herbal medicine. We got everything from arthritis to sleep aid to herpes to HPV. We have it all. Memory.
Okay.
We also have our ginger-based drinks. Our ginger-based drinks that are full of. It's good for your digestive system.
Okay.
It's good for energy if you want some. We have this trace minerals.
Okay.
Which it's like a daily supplement, or you can take it as a laxative.
Okay.
Which will put, once you've taken it, it puts 72 minerals back in your body after you know.
Right, right.
We also have a cough syrup.
Okay.
We have Power Pack, which is in connection. It's like a similar to emergency. It's a natural form.
Okay.
We also have the natural sanitary napkins, which has a negative ion strip in there.
Okay.
It's good for the female body that have a cycle that it decreases the flow.
Okay.
Also takes away the menstrual cramps and stuff
Right.
like that. That's pretty much about it.
Well,
then we
thanks.
have then we have holistic massages.
Okay.
And also we have what we call a Kagan 8, which is an alkaline machine.
Okay.
That we advertise and talk about.
Getting that base down and getting that pH to
Yes,
where
sir.
it's neutral
Yes,
and
sir.
to where it's not so harmful in the body.
Yes, sir.
All right, because
Absolutely.
our bodies were either acidotic or we go the other way with it. So what this does, it brings us down to a natural balance that our body it gets into a natural balance, and the homeostasis of the body is where it needs to be.
Right.
And they're here today, they're offering all these products.
Yes, and
but
we
guess what? Again, you got to be here.
That's right.
So come on in, and they're here to take care of you and talk about all these samples. And folks, for those out there that you're looking for alternative remedies, you don't want to go to the doctor and get all the medicines and things like that. We've got some natural remedies here that's going to help you in your everyday life. So come on in.
Vegan catering as well.
And vegan catering. So I'll probably need your cards at some point. So,
All right. Pleasure
Thank
meeting
you
you,
so
sir.
much. Pleasure
Thank
meeting you.
All right.
Thank you very much.
Get your card.
So, all right.
Go ahead.
Thank you.
You're welcome, sir. Thank you.
All right. So again, we're over here, MLK Dental today. They're coming in. They're checking everybody out. We've got Pete over here. He's getting his dentures checked out, making sure that everything in his dentures are still in place there. So. It was his birthday yesterday, so I'm sure that he was took care of. Say Pete. You want to say anything to your members?
Is the best thing that you can do is come to the health scare greeting at IATSE 479. He's good.
Thanks, Pete. All right. How y'all doing today? Kevin Amick, how are you?
Great. I'm Angeline Butler.
Angeline Butler?
Yes.
And Doc?
Dr. Lee, how are you?
Dr. Lee, I'm great. So y'all come in here today and you want to talk about the hearing and hearing screening and all this. So tell us a little bit about what you got going on, Doc.
Well, we're the Center for Diabetic Hearing.
Okay.
And the reason that we're here is to do free hearing screenings because diabetics are twice as likely to have a hearing loss than a non-diabetic.
Okay.
And we know that on your sets in different places, a lot of people need to have a hearing check because we don't wear hearing protection when we ship.
Okay.
So people getting the screening today do not have to be a diabetic. Anyone can have their hearing check. Just come in, fill out a short form, takes about 7 to 10 minutes, and we're out the door.
All right. 7 to 10 minutes and out the door. And again, that's about like 100% of our membership that has got something else to do. But guys, take time out today. Come down here. We're here until 5 o'clock. These folks have been awesome. They're coming in here, and they're offering so many great things for you today. But we need you to be here to take part of it. Thank y'all so much for coming in. All right. All right. So here we go. We're going to move on. And now, did we miss you, ladies? Oh, we didn't mean to. All right. I think y'all may have. So your name, young lady? Nzinga. All right. And your name? Sharon. And this young lady over here? Amina. And you ladies are here with?
The Atlanta Community Wellness Collective.
Okay.
So we have a variety of services. So we have different modalities. We have yoni steams or hip baths. We have herbal pads for women. We have vegan condoms. We have an esthetician. Amina is our esthetician. Yeah. We
Okay.
also have yoga. We have belly dancing, massages, massage therapy. Am I missing anything?
I would say yoni eggs, just looking at things, a tincture.
Yeah.
Olive
And this
leaf
is really
extract.
good for diabetes, eczema, high blood pressure.
Definitely. All of that.
All right. So, ladies, thank y'all so much for coming out today, offering this information and products to our members. And folks, come on in here, see these ladies, and they've got a product. If you're looking for, again, natural remedies, that come on in here and see them, and they'll take care of you. All right.
Absolutely.
So, I tell you what, let's move this way to the kids zone. So now, for all of you that you're just looking for something for the kids to do today, well, we got that covered too. So now we're coming into the kids zone, and so we've got a lot of folks in here that have come in and just to offer things to us today. Young lady, what is your name?
My name is Chelsea Hunter. I'm from Photo Magic Media. We offer photography services. We are a local company right out of McDonough, Georgia, down in the square. And we offer, wellness from a perspective of being able to give back to the community by raising up the next level of youth that can do what you do.
All right. So come on in and see Miss Chelsea today. They've got a table set up. They got a little bit of swag for you here. But we can come in, enjoy some popcorn, come in and see Miss Chelsea.
That's right.
And she's just going to tell you all about it. And maybe you might be the next, I don't know, someone to grab a camera and go out here and do what we're doing today and go Facebook Live.
That's right.
All right. All right. So, Chelsea, who else you got here with you today?
I've got Jason here with me.
Jason, thanks for coming out today, sir.
We have Brandon here as well.
Brandon, thank you. And Brandon, you are a recent...
I'm a graduate of our ISI program.
Okay, and so he's come in today to help out and be a part of it. But again, if you're looking for another program out there, they offer one right in the heart of McDonough. And trust me, folks, you have to go slow through the square. So drop in there and see them, and they'll be glad to take you in there and show you what they got going on. Thank y'all so much. All right, so now we've got a little bit of face painting and stuff going on. And so, you guys are coming in here? No. No.
What are these? Stars.
MPV, MVP, and so, right. So, tell me, what's your name, young lady?
My name is Azrian. This organization is called the Kitty Olympics. Basically, this is for childhood obesity.
Okay.
So,
Basically, we got a little face painting over here, going over here. We got prizes over there, soccer. Basically, this is encouraging children to be more physical fit.
All right. Well, great. Thank y'all so much for coming out.
problem.
Your name,
Thank
young lady?
you.
Ari?
Ari McElhenney.
All right, and your name?
I'm Jasmine.
Jasmine, sir?
Trayvon.
Trayvon. So listen, folks, they come out here today. You bring the kids. They're going to show them how to exercise. We got some fun games over here. Got going on over here. And so, folks, we're just out here. Got in the kids zone. Young man, what's your name?
Derek McLendon.
Derek McLendon. And Derek, now are you the official rep with Kiddie Olympics?
I am.
All right. Do you have anything you'd like to add about Kiddie Olympics and everything coming
Well,
here today?
we work with kids on childhood obesity event. We teach kids how to play 60 minutes, 60 minutes a day, or
Okay.
30 to 60 minutes a day. At a Kiddie Olympic, kids are involved in several different events that we have, pogo ball, soccer ball, the pogo ball. There's tug of war, but we didn't have the room in here to do it. It's a little chilly outside to
Right.
do tug of war. So, but we're glad to be here. This is
All right,
great.
thank you so much, sir.
Thank you for
We
having me.
appreciate you coming out,
Yes,
enjoying
sir.
the music.
Oh, yeah.
keeping us going with some music over there.
Yes, sir.
Had the jazz happening earlier.
Count Basie, I can do it all.
We got a little bit for everybody.
Yes, sir.
It's kids zone, but we got to take care of the parents too.
That's right.
So come on in and let the kids come in and play. We're fixing to go outside. I got something else for the kids, but follow me.
Yes, sir.
By the way, that's my grandson. He came down to be with us today. And my granddaughter over here. And that's Ray Ray. And she's come out to play today. She's going to be a part of it. And we're going to go outside. Okay. All right, so here we go. Here we go. So here's the next thing that we got. And so we've set up outside. And we've got the bouncy house out today, and we'll get them out here. They get in the bouncy house, and all that energy that they pent up on Saturday, you can let them come out here, jump around in the bouncy house and have fun. And right now the line's not that long, but we really would like to see a long line out here. Bring the kids out, have a good time, and just let them enjoy the day. When you come in here, as you're coming in here to get yourself taken care of, let the kids burn some of that energy so they're not getting in trouble for running around the house. And we've also, we've already talked about the guys from Clayton County Fire, but as you can see over here, they brought the fire truck. But listen, folks, we got a lot going on today, and the only thing missing here today is you. Come on out and be a part of it, and take care of yourself. We look forward to seeing you. Thanks much.